What is up, you guys? Welcome to another video with Spencer here on my personal channel, and this week we are talking about my 3 weeks update on what I've been doing with the current incisions that I have. I had a complication, hyperpigmentation, and atrophic scarring along my incisions after top surgery. I had top surgery with Dr. Alan Doolin in Plano, Texas on April 3rd, 2018. It was double incision with free nipple grafts, and I had this complication. I've been doing this treatment, and this is the halfway point. So this is what my chest looks like now after 3 weeks of both using hydroquinone 8% and kojic acid 2% suspension, as well as laser therapy to get rid of the scarring. And yeah, I'm going to talk about my chest and show you what it looks like and put in some before and after pics so you get a full understanding. But before I get into that, I do want to talk about something that I was currently battling, and now I finally clawed myself out of that hole, and what that is the depression that I experienced after top surgery. Now, if you don't know, top surgery for me was a very difficult experience to come by, not only with the money issue, but I had a lot of health issues, especially dealing with my blood. I had a clotting disorder as well as a lot of other abnormalities with my blood work that made me a high-risk candidate for any type of procedure, especially something that most people consider, rephrase, something that the cis community considers elective. So it was a fight. It was a battle, tooth and nail, going to all these different types of doctors, being on all these different types of medication to get my clotting time to be within normal limits, which is 30 seconds or less, and then finding a doctor that was willing to operate on someone that was high risk as I was. Once I was able to get that, I thought the hard part was over, but it was not. It looks like the hard part came after the fact when I had this complication, and it really got me down. I had a very difficult time enjoying the fact that I had top surgery, that I don't have to wear a binder ever, that I get to wear tank tops whenever I want to, that I get to have this flat chest. And honestly, after really taking a step back from the situation and analyzing it, my dysphoria has gone down so much. It is incredible what I had, the fact that I had top surgery and the amount of relief it has given me, even with this complication. So I just want to talk to you about a little bit of tips and tricks that I've done trying to, get through the hard part, especially dealing with a complication, and maybe you guys can apply it to yourselves if you have any type of complication or just waiting in general when it comes to transition. So one of the first things that I did, and what I would strongly recommend for everyone, is to find someone to talk to, some support system, something. I have a therapist. I also have friends and family that are willing to be supportive for me. So it was really great to have a therapist or someone to talk to about, how I'm feeling and the sadness I'm feeling about it and how to make myself feel better. So I recommend a therapist or friendships or anything that you can just talk to somebody and talk it out. And there are support groups online that I definitely think that everyone should visit if they're dealing with some type of complication that can definitely get you through the hump of, that depression, that sadness, that anger. So once I got out of that, I then started thinking of things that would make me feel better, coping skills, whatever, to make me feel better. And one thing that I really enjoy is shopping. I had this huge list of things that I wanted to do topless, and I kind of thought that those things would be placed on hold because my scars were as bad as they were. And that's not the case at all. So to make myself feel more confident, I decided, and this may be good or bad, take it as it is, but I decided to make every other part of my outfit, because it's, I'm going to be topless, be exactly how I want it to be, because I can control those things. So the first thing I did is bought a swimsuit, and that's something very simple and very easy. I particularly really love a brand called Chubby's. I really wanted a chubby swimsuit. I told myself once I got top surgery I would get a chubby swimsuit, and so I did. I got chubby chunks, and I really love them. I mean, they're expensive, they're $60, but that's something that I really wanted, and that's something that I told myself I was going to get after top surgery. So even though I had this complication, my topless dream is not over, and to make myself feel better, I went out and bought these swim trunks. The next thing I did was I bought Ray-Ban sunglasses, and that was kind of just like a, I want Ray-Ban type of thing, and I feel like I deserve it. So I went and bought Ray-Bans, and I bought, some flip-flops that I wanted, and I bought the swimsuit that I wanted, and basically I created an outfit with my, being topless that would make me feel super confident to get over the fact that I have this scarring. And it's worked very well with me. I was able to get some tank tops that I really like, and I was able to, you know, exist out in the summer without a binder, and just being reminded that I don't have to bind anymore has really brought myself out of this depression that I had because of the scarring and everything else. So those are just some tips and tricks of what you can do if you're dealing with a complication to make you feel a little more better about the situation. And also just be, you know, reminded that it takes time and your body will heal. It was really hard for me with this type of procedure or course of treatment because it wasn't something that was immediate. Usually I'm used to taking a pill and nausea will go away, or I'm used to taking this and everything else will go away within a matter of 30 minutes to an hour, where this is a 6-week long period. And I kind of am comparing this this complication and the recovery from this complication to that of testosterone. So when you first inject yourself with testosterone, you don't immediately grow facial hair. You don't immediately see your voice drop or fat redistribution. It's a long process, and it's also really hard for you to step back and see the progress you have made unless you look back, you know, 6 months prior. And that's kind of something I had to do. I don't see progress with this treatment every day, but every week when I compare my pictures to what it was when I first had the complication, it looks drastically different to me. And that's something I have to keep reminding myself. Every time when I wake up and I still see these dark marks, I gotta remind myself that, remember 3 weeks ago, it was even darker and even more spread out than what it is now. So without further ado, I'm gonna show you my chest, show you how it's been working, and let you know what the treatment plan is from here on out. Alright, so this is what my chest looks like. And it's faded quite a lot. There has been drastic amount of changes that I experienced with the treatment. Again, it's 8% hydroquinone and 2% kojic acid twice a day, as well as laser therapy once a week. And I kind of am shocked. You know, I didn't really know what to expect, and the first week was really hard. I was like, keep walking around telling people, does it look lighter, does it look lighter? And everyone's like, no, not really, it's only been 3 days. So like, I was really, really worried that it was not gonna work, but it has worked a lot. I'm definitely gonna add a clip and some pictures of what it looked like before. So you guys can see that and compare, but it's definitely changed, it's definitely lightened up. And I'll give you a close-up view of what it is. So you can see the regular skin coming through and everything else fading, which is what we wanted to happen. And yeah, that's what it looks like. Nipples are healing great. Less pinkness than before. I don't really know how long that's going to take to come into full, you know, effect, but I'm told it can take up to a year, so that's where it is. But yeah, it looks great. It's definitely working. And prognosis, no. Treatment plan is to continue as directed for the full 6 weeks, and we will reassess. My dermatologist is unaware of whether or not she's going to have me continue after the 6 weeks, but, you know, take it a day at a time. At least that's what she tells me. But let's just talk about mobility and just general top surgery things. So my mobility is 100% back to normal. I can do everything that I've done before with no complaint. I haven't been in the gym. I need to go back to the gym, but the contouring is still great, and it's just like, I don't know, it's great. It's what I am, top surgery. It's exactly what I wanted. It's exactly how I wanted it to be. I am flat, 100%, as you can see, and that's fucking awesome. And yeah, it's been awesome. So that's where I am. I will update you guys again in probably another 3 weeks or sooner, because I will be going to camp. If you don't know, I do go to Camp Aeronautic, which is a trans-exclusive camp for the ages of 5 to 15. I will be there June 22nd till July 7th, I think. One of those days. So if you're going to be at camp, definitely hit me up and let me know. I'd love to meet you guys. But anyways, this is all I have for you today. If you have any questions, comments, issues, problems, concerns, please feel free to leave them down in the comment box below, or hit me up on any of my other social media sites. I will definitely tell you, I will definitely update in the coming weeks, probably 2 weeks, 3 weeks, who knows. But yeah, This is my chest. Today is April 6th, so I'm a little over 2 months on postdoc with Dr. Doolin, and I am a little over 3 years, April, May, June, 3 years and 3 months on testosterone, which is incredible to say. So yeah, that's all I have for you today. I hope you're having a great week and are gearing up for an even better weekend. It is someday. It is Spencer. Until next time.